So we've spoken a bit about different types of therapy. So today we're going to talk a little bit about different types of practitioners, so different types of therapist. There can be quite a lot of confusion around whether you feel that you need a counsellor or a psychologist or a psychiatrist. So I'm just going to talk you through the difference in what those people do. So first we have counsellors and psychotherapists. So counsellors and psychotherapists offer talking therapy. So they are looking to try and understand what's going on, to help you unpick, understand, cope with, manage, express how it is that you're feeling. So they're concerned with your emotional health. They're going to be talking to you about things like anxiety, depression, relationship difficulties, life dissatisfaction. So they're thinking about how to make life better for you. So we're talking about lower level mental and emotional distress. There are lots of different types of psychologists. So we have clinical psychologists, educational psychologists, behavioural psychologists, counselling psychologists, but generally psychologists are seeing people with a higher level of mental distress. We're looking at more serious mental disorders, things like psychosis, personality disorders, real entrenched eating disorders, learning difficulties. So they're looking at that kind of next level up, and they will have been kind of scientifically trained, so it's much more scientifically based. And psychiatrists are medical doctors who are qualified in mental health, in psychiatry. So they can diagnose, they can help you manage, they can prescribe medication. So they are medical doctors who specialise in mental health. So what is your counsellor or psychotherapist actually going to do? Well, they're going to help you understand what it is that's going on for you. So they're going to help you to unpick how you're feeling, make links back to different areas of your life and through different parts of your life. They're going to listen, they're going to reflect, they're going to leave a space for you to try and figure out what's going on. But they're doing a lot more than it seems like they're doing to you. So it may seem like to you they're sitting and they're listening and they're understanding, but they're also thinking about how does this link to other areas of your life? What is it that you might need? What are your attachment styles? How do they need to be with you in order to help things to repair? So there's a lot going on in terms of what your counsellor is thinking about and how they're trying to offer you the best service possible. In terms of things that they don't do, your counsellor is not going to judge you. So it's a safe space. You can say whatever it is that you want to say in that room, and it's not their job to judge. It is their job to try and understand. But they're also not going to give you advice. They're not going to fix it for you. They're not going to just give you coping strategies. So if it was as easy as I have anxiety, I need some coping strategies, you would be able to Google it. But that doesn't exist because coping strategies for each person are going to be different. So a counsellor is not able to just give you coping strategies, give you advice, tell you what to do. It's a process of figuring that out together and what's going to work for you. But how do you choose a therapist? So it seems like an absolute minefield when you decide that you would like to have some counselling and you're trying to search for a therapist and you feel like you have no idea what you're looking for or what this person is supposed to be like or what they're supposed to have. So I'm going to use my counselling directory profile to just highlight some of the things that you're looking out for when you're trying to choose a therapist. So you'll see on here that there is a blog. So counsellors will write a little bit of a blog about who they are, what they do, what counselling means to them. So if you have a read through that, you'll get a sense of what this person is like and whether or not you feel a connection with them. Further down here, you will see training, qualifications and experience. So this is really important. Now, to get onto these types of advertising platforms, counsellors have to prove that they are qualified to a certain standard. So you can feel safe in that, but just have a look at their qualifications. So you can see here that I have my qualification in counselling, I'm qualified to work with couples and have some training to work with groups. So what you're looking for here really is to make sure that the counsellor that you're looking at is qualified to work with whatever it is that you're bringing to them. So if you are contacting them for couples counselling, this is the area to look to ensure that they are trained and qualified to be working with couples. So you'll notice here, if you were looking at my profile interested in family therapy, that I don't have a qualification to work with families. So I would not be an appropriate counsellor to work with a family group. But what you'll also see down here is experience. So you can see here that I've worked for a long time with young people and teenagers. And so if a counsellor has a lot of specific experience in a certain area where they will have received additional training, then you may feel reassured that that person is then appropriate to, for instance, work with young people. Then you'll see that I am a member of a professional organisation. So all counsellors should be a member of a professional organisation, and there are different organisations available to us. So there should be something here. They'll then outline the different areas of counselling that they deal with. So this is the kind of presenting issues, the things that people bring to the counselling room that these counsellors in particular are okay to deal with. So you may see what it is that you're struggling with on that list. And then the therapies offered. So we've obviously talked about the different models of therapy, and that's where you'll see some of those words becoming apparent. So I am trained in an integrative model. So what you'll see here is that these are the models of therapy that I bring together, that I integrate in order to work in the way that I do. You'll then see maybe some photos, videos of the space that your counsellor works in, how much they charge, if there are any concessions offered, and just any bits of kind of further information. You may see up here where your counsellor works, but a lot of counsellors will keep that information private until they have an appointment booked in with you. So you may not always be able to see exactly where it is that they work from. And the type of session, so whether they're offering in-person, online, phone, types of clients that they work with, and if they're offering any kind of online platforms, things like Zoom or Skype or Doxy, and whether they're kind of DBS checked. So that's what you're looking for in terms of your therapist. And from this page, you will get a little bit of a sense of who they are. You'll see a photo, you'll read a little bit that they've written, and you'll get a sense of if this person seems like somebody that you would like to meet with. And then really it's a case of contacting them, seeing what availability they have, and possibly getting an initial consultation booked in. So going along and meeting them in person or online, however it is that you're doing it, and getting a sense of if they seem the right fit for you. And it may be that you want to meet a few counsellors before you decide kind of who it is that you would like to see on a longer term basis, just to make sure that you're getting the person that you feel the most comfortable with, that you feel gets you the most, that challenges you in the right way. So next week, we're going to talk a little bit more about that initial consultation, what will happen and what happens generally in counselling and how to get the most out of it.